And I'd like to welcome you to tonight's webinar on TRAKnet's Total Practice Solutions, putting all the pieces together to improve workflow. My name is Dr. Alan Bass, and I'm a Senior Healthcare Consultant with Collaborative Practice Solutions. I also serve as the Medical Director for TRAKnet Practice Solutions, so you may have heard me present on other webinars. So I'd like to welcome you to tonight's webinar on the total practice solutions that we have to offer. Just a little bit of housekeeping this evening. Tonight, for tonight's webinar, Collaborative Practice Solutions is sponsoring it tonight on behalf of TRAKnet. And you're all in a listen-only mode. I am recording tonight's webinar, and for your review, it will be up on our YouTube channel within the next couple of days. And please remember, while I don't have a slide here reminding you of it, we have a series of webinars that will be going on over the next several Tuesdays, tonight and over the next 3 Tuesday nights, talking individually about all of our total practice solutions on an individual basis. Tonight we're going to focus really just talking about all of them in a short summary, just to give you a little taste of what's coming from TRAKnet in regards to the different products that we have for your workflow and what's coming down the pike over the next 6 months to 12 months to a year or two as we talk about value-based medicine and what TRAKnet is doing to prepare for it. So for some of you who've been around in practice long enough, I've been in practice a little over 20 years. Electronic records, as we called them back there, actually just started out as an EMR. There was no such thing as an electronic health record. It was just a data recording. Some of them were very, very primitive. I will tell you that I started working with TRAKnet in more of its infancy, which was several iterations ago, when TRAKnet was first developed as PodMed many years ago, by a podiatrist. Then it evolved out into electronic health records, which included some billing. A lot of times, a lot of the billing was done by a separate program. I know when I first started in private practice, even before an electronic health records program, I was keeping my notes in a just in Microsoft Word, and I was doing all the entry into a program just for billing. Now EHR is involved into a total solutions. It includes billing, it includes scheduling. There'll be some things coming down the road you'll see with us that are really going to allow you to have everything all in one. Because now it's not just about having just your medical records, just your billing at your fingertips, but so much more. And what you will hear me say tonight more than anything else is data. About having the necessary data to run your practice and about what's going to be needed in the next several months and years to come as we evolve from a fee-for-service industry and having our income based on how often we bring patients into our offices, but more of a fee-for-value and in the value-based medicine world. So let's talk about what TRAKnet is doing over the coming months to get you ready to be more than just an electronic health records program, more than just for your records for your patients, more than just doing your billing and your scheduling. Let's talk about what's coming down the pike. So what's coming is the first thing we're going to be talking about tonight is our integrated patient portal. The next thing that's coming is something called code audit compliance. You may have also received an email earlier today from Dr. Jeff Frederick a small video talking about what code audit compliance is, and I'm going to show you what that is in just a short summary this evening and get more into it on upcoming webinars. My practice report card, also something that is integrated directly into TRAKnet, and something that's also going to help just improve not just your workflow, but really just to get a handle on what's going on from a quick glance within your practice. We're going to talk this evening about the Advanced Data Management Platform, the new reporting platform that is within TRAKnet. And last but not least, we're going to talk a little bit about Virtual Practice Optimization, or VPO, which is our newest report that can come directly from Collaborative Practice Solutions. So let's dive right in and talk a little bit about the integrated patient portal and how it will be useful to you within your practice. So, as some of you may have seen from other physicians' offices that you go to, your primary care physician or any other medical specialty that you go to, an integrated patient portal is great because any integrated portal, any portal that a physician's office has, is integrated directly with their electronic health records program. And our integrated portal is going to be no different. It's going to be integrated directly with TRAKnet. It will, more than anything else, allow your patients to start interacting with you early on. Meaning, the only thing that you need from your patients to make an appointment in TRAKnet right now is a first name, a last name, a date of birth, and their zip code. Those are the only pieces of information that if a new patient calls you on the phone, those are the only things that you need in order to schedule that appointment right then and there. So if you're busy, if your front desk is busy and the phones are ringing off the hook, what it's going to allow them to do is to just get those pieces of information, make the appointment, and only grab one other piece of information, and that's going to be the patient's email. Because what they're going to be able to do is send the patient a welcome email that will then allow them to sign up for your practice's patient portal. And what it's going to do is allow patients to sign up for that portal and enter data at home that is ultimately going to be sent from them directly to you and will automatically pre-populate specific areas within TRAKnet. More than anything else, it's going to improve workflow because certain pieces of information, such as medications and allergies, don't have to be populated by your staff when the patient comes in. There's no need for that because the patient will be able to enter that information at home. It will get pulled into TRAKnet by you. And when the patient comes into your office, all you'll need to do is confirm it. Of course, you'll be able to update it if you need to once the patient is there, if they forget anything, but it saves the time from the data entry. You'll also be able to have your patients request appointments online. So you'll be able to set parameters on which doctors, which locations, when you have office hours, when you don't have office hours, and patients will be able to request an appointment time from you. They're not going to be able to see into TRAKnet or make the appointment. They're going to be able to request specific appointment times. And one of the things that I think is the best thing about the patient portal is that it's going to allow for your patients to make payments online. So you'll be able to send out your statements and then indicate on your statement, just like you'll be able to indicate that a payment might be overdue. They can then sign up for your patient portal and then make outstanding payments online. Just to give you a little bit of what it looks like. And next week's, and I'm going to say it again at the end, next week's webinar is going to go in depth into these areas of the patient portal. And you'll see the patients will be able to enter in their demographic information, their insurance information, and all different information in order to then take that information in the comfort of their own home and click on the Send Info button, and will automatically be sent to TRAKnet, and you will get an alert right in TRAKnet, and it will tell that you have a new connection or a request from a patient, and that information will be able to be put directly into TRAKnet. And we'll go more into depth on all of these different areas and how it's set up with your patient next week. Let's talk a little bit about code audit compliance. What your code audits compliance is again, it's integrated directly within TRAKnet. And as Dr. Frederick said on today's email, it allows you to see a snapshot of your codes against the approximately 2,000 other TRAKnet users. The most commonly used codes, you're going to have a comparison between yourself and the other users in the TRAKnet world. To give you an idea of what this looks like, and this is just a sample data, a test database, so you're not going to see any things. You're going to see under the column on the right side, certain columns have no data at all. Again, this is just in a test database, but what it will do is look at the most commonly used codes, and you'll see them in a numeric order on the right-hand side of the screen, and it's going to compare your month-to-date and your year-to-date utilization of the top codes compared to all of the TRAKnet users month-to-date and year-to-date on the right-hand side. On the left-hand side, on the upper left, just talks about your encounters. And on the bottom left, it's going to talk about your top 10 CPT codes for your practice for that, they're going to do. And it gets updated every month. So what I'm showing you here is going to be the top 10 CPT codes for the month of March. And then next month it may be different because it's going to start looking at the codes on a month-over-month basis. And this is just a snapshot which is going to be able to show you, are you an outlier? We're all quite leery of audits by insurance companies, whether post-payment or prepayment audits. And code audit compliance will allow you to look at your code usage more than anything else and allow you to be proactive in making certain that you monitor yourself and make sure that the coding that you're using falls in line with the rest of the TRAKnet community. Now realize, I understand some people live in heavily populated areas, in other areas where it's different. So we can't say for certain that everybody, we're not comparing you to everybody in your area, but by comparing you to the TRAKnet community across the country, that gives you a good idea based on big practices, small practices, urban area practices, suburban area practices, and how you're going, where you are in regards to all of the TRAKnet users. A very good tool to self-police yourself more than anything else. Let's talk about My Practice Report Card. Again, something that's integrated directly within TRAKnet and something that's complementary. It's there, and it allows you to see a static snapshot of just some certain financial information about your practice. It's updated each and every month, and you'll see these 6 different pieces of information: aged claims, new to total patient ratio, your collections, your charges, and your total claims. It's going to, again, allow you to look at your own practice in just a quick snapshot with just a quick click of the button from your TRAKnet desktop and allow you to see how you're doing in a quick month. Again, just some test data just to show you how it looks. You're going to see how your practice is doing against the industry benchmarks more than anything else. That's what's important. Looking at the industry benchmarks, how does my practice do compared to how everyone else is doing? Now, these industry benchmarks are not just TRAKnet, but these are industry benchmarks across the entire medical community, not just podiatric community, but the medical community more than anything else. Because these different pieces of information, you look at them more from a practice management standpoint, not even from a TRAKnet standpoint, and not even from a podiatry standpoint. More just a practice management standpoint for healthcare. So that industry benchmark is not going to change each month. It's really just your practice information is going to change each and every month. Now, you're going to notice that certain information is going to be on a month basis. Certain information is going to be on a 6-month basis. Some is on a quarterly basis. Because to break down some of the information, such as net collection ratio on a monthly basis, it really is not an accurate indication, because if you try to break down net collection ratio on a monthly basis, it doesn't allow for the full cycle time of claims to really give you an accurate indication. So extending out the period in which net collection ratio, for instance, is looked at allows for a full cycle time of claims. Again, this is something that is directly on your TRAKnet desktop, and just by clicking on it, it's going to be able to pull that information directly from your database. Let's talk about the Advanced Data Management Platform, something that we're really proud of, because one of the things that we've been told is that our reports could be better over the last, and it's really need improvement over the last couple of years. So the Advanced Data Management Platform is going to allow you to compare to your peers and help identify certain financial issues that are going on in your practice. Being able to have the finger on the pulse of your practice is so important, because so many times people have guessed at what is going on with their practice. How are my collections? How are my new patients? Which insurance company is better for me? These things are going to allow you to have the tools that really provide you some good practice management, and that's what it's all about. The ADMP is a series of in-depth reports, and it's only available to TRAKnet users. There are 35 advanced reports on top of the old reports and queries that are within TRAKnet. They represent not only raw data, but they're aggregated into graphs. And why this is so important is they need to truly understand what their bottom line is. And when we talk about what's coming down the road in the months and years to come in value-based medicine, it's all about improving patient outcomes. It's not going to be about bringing in a patient over months and months to get their plantar fasciitis better. Their insurance companies are going to look at how quickly you're going to get your patients better. And that's what's available to you now in the Advanced Data Management Platform, more than what we've had in the past within TRAKnet. So by signing up for your Advanced Data Management Platform, when you sign up for it from your billing dashboard within TRAKnet and clicking on reporting, you're going to notice that a fourth tab is next to the 3 tabs that are there. the reports and the legacy reports, plus the queries, and you'll see that advanced data management platform. You'll see that it has an entire list, and in this presentation and the PowerPoint I can't show you. This is just probably the first half of the different reports that are in there, and you can see some of the different pieces of information that are in the ADMP, the Advanced Data Management Platform, that are not within the reports or queries. And you'll be able to see that, for instance, on this one, the CPT analysis, it's going to be able to look at so many different pieces of information, and it's going, and some of the different graphs that we show you are in graphs or just in columns. It's going to just provide you with more information than you've ever had previously within TRAKnet. And the newest and most unique thing that comes from collaborative practice solutions in working with TRAKnet is something known as our virtual practice optimization report. And what the virtual practice optimization report is, it's what we like to call a SWOT analysis. SWOT standing for strengths, weaknesses, opportunities, and possible threats within your practice. And while you may think that VPO is just another report, it's not. But what the VPO report is the report, but it comes with an analysis of the data and the recommendations that go along with that data. And just a few things that it shows. We talk about patient trends, whether it's total patients, new patients, total versus new, recall rates. We go into the financials. The VPO goes into the financials of your charges and your collections. It looks at key services such as at-risk foot care, orthotics. And one of the most unique things that we've done is that Collaborative Practice Solutions has now partnered with top practices run by Mr. Rem Jackson. And we've now developed the Virtual Practice Management Institute. And so many of you have called myself, Dr. Juliana, who's the managing partner of Collaborative Practice Solutions, and have inquired about coming on site and doing evaluations. Well, through the use of the VPO and through the use of the Virtual Practice Management Institute, we're able to provide our consulting services remotely. You're able to get the best of both worlds. Through the VPO and through the different webinars and teleconferences and coaching calls that can go on through the Virtual Practice Management Institute, you're able to get an on-site visit done remotely and much more cost effectively. Because I know I could tell you that having somebody stand in your office can be very obtrusive. Could be obtrusive to your staff, could be obtrusive to patients. And being able to get the same services remotely is very effective and, more importantly, very cost effective. So just a few graphs to look at as it pertains to the Virtual Practice Optimization Report. For instance, this graph talks about new patients, and it's a new patient trend, how it is year over year. How does it, and you could see that we look at all new patient codes, not just office codes, but consult codes as well. And we look at that, and we'll do it. Certain things, new patients will trend month over month and year over year. You could see we break it down also by provider. So not just is it going to tell you how many new patients you had year to date, but for multi-physician practices, you'll be able to see things not just for the practice, but break down by provider as well. You'll be able to see the trends. So you're able to see through graphic analysis, this is a 2-year, how is the practice doing month over month just on that new patient. So you're seeing not just year over year, not only by provider, but a trend over the last 2 years. And this is just a small sample. We do this for new patients. We do this for total patients. We do this for a lot. But some of the most unique things we're able to do is provide you with a comparison on how you do for certain key services based on diagnoses. So for instance, in this graph, we're able to tell you how all of your year-to-date patients who had, now in 2015, we had to include both ICD-9 and ICD-10 codes. So for all of your patients who had plantar fasciitis and calcaneal spur, how many of those patients received orthotics? And we're also to be able to give you that percentage and whether or not you fell within the industry median for that specific service. And then if you don't, recommendations are made that from your VPO report, you could then sign up for the Virtual Practice Management Institute, and we could provide you with protocols and coaching on how to improve that specific area. We also look at things such as plantar fasciitis and the use of night splits. In this sample graphic indication, you could see that there's no use of night splints and that this practice would fall below the industry standards, and that we would suggest them joining the Virtual Practice Management Institute so we can provide them with protocols on how to include things such as night splints and durable medical equipment into their practice. So you could see that the VPO is not just a report that we're going to just hand you and tell you, here it is. We're going to provide you not only with the graphs and the numbers, but the analysis and the recommendations in order to make all of it mean something to you and how it's going to improve your practice and improve workflow within your practice. So some of the things that are coming in the next several months are very exciting. So in addition to these total practice solutions, TRAKnet is going to be launching a significant update. And the update is really not going to be readily apparent, but it's going to include some important things. The update is going to significantly improve the speed of the application and allow the application to be used on a lot of different devices. And one of the things that we've heard more than anything else is to continue to reduce the amount of clicks to make it easier to use on a day-to-day basis. And that's what's going to be coming down the pike. A faster, more user-friendly application. But beyond the use of TRAKnet, it's very, very important for us to keep our eye on the ball and what the end game is. And unless you've had your head in the sand and maybe you're not a member of APMA or don't belong to your state organization, you may have not even been familiar with the terms value-based medicine. And I've talked about data. And everything that I've spoken about this evening is all based on data, whether it's code audit compliant, whether it's my practice report card, whether it's ADMP or VPO. These things are all about data. And what we are preparing for in this update is for data mining, being able to get the data that you're going to need in the future of value-based medicine. Because while the users may not see it going on right now, we're not thinking about the next 4 weeks. We're talking about not only the next 4 months, we're worrying about the next 4 years and beyond that. And what's happening, not just in podiatry, but in all of medicine, is we're moving to value-based medicine. You know, I had the opportunity to speak to a state organization last week, and what we've always talked about in the past is, you know, you probably have heard the term per visit value, or PVV, and really what that really should have been known as in all these years is actually PVR, per visit revenue. And really what's happening in the future is what's going to be PVV, per visit value, because your value, the insurance companies are going to look at your value based on the other podiatrists in your community. And being able to have the data within your EHR to go to your insurance companies to show that you provide better value is what it's all about, more than anything else. So there's going to be no learning curve with this update of TRAKnet. It's going to look and feel and work exactly the same, only faster and more efficiently. But beyond the speed, we're going to, again, have you be equipped to be ready for having that data at your fingertips. Being able to have this done seamlessly, and being able to have this done where it's just as easy as it was before. Just like we gave you with ICD-10 and with Smartsheet, we're going to give you that exact same thing with the new version of TRAKnet. It's going to be easier to use, but it's going to work exactly the same. One of the things that I'd love for everybody to do is visit our YouTube channel and take a listen to the recent webinar from Dr. Juliana and Mr. John Liardi, prominent healthcare attorney. And they talk about a glimpse into your future, and they talk about what is so important in the future. Data is king. Data is the most important thing that you're going to need at your fingertips more than anything else. So Collaborative Practice Solutions, along with TRAKnet, Total Practice Solutions, is going to allow you to have that information at your fingertips more than anything else. So I'd like to thank everybody for joining me this evening on this webinar this evening. And what I'd like to do is invite you to next week's webinar that's going to go more in depth into our TRAKnet integrated portal more than anything else. We want you to understand how something like the portal works and how it's going to help you improve your patient workflow more than anything else. So what I want to do before we sign off, I want to just take a quick look at some of the questions that came up this evening. I'm just going to take a moment to pull them out and see if I can see what they are. Let's see what we got here. Let's see if I can get some of these questions answered. Give me a moment. So somebody asked this evening, Dr. Vedder, you spoke about certain reports. If you've got certain reports in mind, you can all see there's my email at the bottom of the screen, abas@collaborativepracticesolutions.com. If there's certain specific that you're looking for, please let me know. there are, Dr. Vetti, you also asked about a marketing referral. I believe in the new ADMP, there is a top referral report. As long as that's entered by your staff, that might be able to answer those questions. So is the patient portal complimentary? So the answer to that is the portal, as well as the code audit compliance and my practice report card, are all part of an upgrade that's available now for a free trial. So if anybody is interested in getting some of these new things, what I'd like for you to do is contact sales at TRAKnetsolutions.com, and you could definitely inquire about the use of code audit compliance, the portal, and my practice report card. Take it out for a test drive and see if it's right for you. So in regards to that, and I'd like for you to address any questions that you might have in regards to sales, how much it would cost directly to the sales department. I know they can answer that much better than I can. I'm just going to stay on these questions for just another minute, see if there are any other specific questions about any of the products on the solutions we talked about this evening. Well, it doesn't look like anything else is coming in this evening. So I'd like to thank everybody who joined me this evening. Please sign up for the webinar next week, next Tuesday night, on the use of our integrated patient portal over the next couple of days. I think, again, on Thursday and even next week. If you can't find the email that you previously got to sign up, you'll be getting some email reminders of them. Please feel free to sign up. And I look forward to speaking with you on next week's webinar. A recording of tonight's webinar is going to be on our YouTube channel in just the next couple of days. I'd like to thank you again for joining me. And with that, we are adjourned. Good night.